So we get a lot of questions about drains, whether or not you're going to need them, depending on what procedure you're having. A lot of that depends on what you're having in your anatomy. Drains they can be one of the parts that is feared most about surgery. They're annoying. They are not the most comfortable thing in the world. They're also not the worst. And the trade-off, when they're needed, it's much better than the problem that can arise if you don't have the drains. So the goal is to make sure that fluid is not accumulating faster than your body can kind of handle it. So if for some reason you need a drain, tummy tucks usually have them, 1 to 2 drains. Breasts, sometimes I try to not have drains whenever possible. If you do have them, you have a little silicone tube coming out that's sutured into the skin and a little bulb that looks like this. You check it a couple times a day, see how much is in there, record it, and then put it back on suction, and it helps to kind of slowly take fluid out. It's not going to be amazing. Usually it's about a week. If anything, it does help to kind of anchor you, just because you might want to do too much too soon. The annoyance of this might help stop that. But then once you get them taken out, it's just a small snip of a suture. And granted, I've never had drains, so I don't totally know. But I've heard it is weird, not painful. So it's a daunting part of surgery if you need it, but it's definitely not the end of the world, and they do help.